Welcome to Culture Shock Therapy, your health equity prescription. I'm your host, Dr. Katrina Gipson, board-certified assistant professor of emergency medicine and health equity thought leader. If this is your first time joining us, hopefully it won't be your last. Now, to orient you, this is a platform in the podcast universe where we discuss how policy and pop culture impact the social drivers of health and health inequities. Before we go any further, I'd be remiss if we didn't wish everyone a happy 100th Black History Month. Now more than ever, it's important to celebrate the contributions and achievements of marginalized and disenfranchised persons in this country. Black history is so much more than our pain and struggles, but it's about resilience, innovation, and the joy that we developed to overcome them. Now, we haven't touched base since the Trump administration took over, and if you're like me, you're experiencing a wealth of emotions: anger, hurt, disgust, fear, or even helplessness as new policies and executive orders impact our lives and members of the community. And that's kind of the point, to overwhelm you to the point of feeling helpless, leading to inaction. So last year was not only long, but full of transitions. For me personally, that meant a new academic hospital in a new city and in a new state. I stepped back to listen to patients, to systems, and myself. Physicians, we often neglect self-care. We kind of fall on the spectrum of do as I say and not as I do. But I stepped away, not because the work mattered less, but because the noise was getting louder than the truth. This gave me the space to watch, listen, and think clinically, ethically, and as a physician. Now, with 2026 well underway, I strive to reaffirm this podcast's purpose. Culture Shock Therapy will continue to focus on clarity, clinical truth, and accountability in health equity, and actionable items for our listeners. For many of you, this is old hat, but I think it's worthwhile to review. What exactly is health equity or health inequities? So, health inequities are avoidable, preventable, and unjust differences in health outcomes. They result when your zip code impacts your health outcomes more than the medications or interventions that your providers prescribe. It's when intentionally biased systems and policies allow or directly intend for factors such as socioeconomic status and marginalized identities such as race, ethnicity, religion, or sexual orientation to negatively impact health outcomes. Let's start with a little example. Health inequities result when Black patients are less likely to be prescribed opioids relative to their white counterparts for the same levels of pain due to implicit biases held by providers regarding who is more resistant to pain. Now, according to an article published in Proceedings of the National Academies of Science, half of trainees held false beliefs such as Black patients' nerve endings are less sensitive than whites, or Black people's skin is thicker than white people's. How about another example? Health inequities exist when Black pediatric patients are less likely than their white counterparts to receive laparoscopic or minimally invasive surgeries for procedures such as appendectomies or removal of the appendix. And this is from an article in the Journal of Surgical Research published in 2024. Access to laparoscopic pediatric surgery. Do ethnic and racial disparities exist? Now, more invasive procedures often result in prolonged and thus more extensive hospital stays with more post-operative complications. Equity is a quality issue. It's a patient safety issue. It's a policy issue. And it's a leadership issue. Now let's revisit what are the social drivers or determinants of health. There was a time when we used the terms interchangeably, but the social determinants of health include systemic variables impacted by race, ethnicity, socioeconomic status, such as access to adequate education and the economic opportunities provided by said education, access to healthy, affordable nutrition, safe neighborhoods that aren't subject to over-policing, and housing with green spaces to exercise and build community, economic stability, and ultimately access to affordable and effective health care intertwined with cultural humility. The social drivers of health implies less finality. It reinstores individuals' autonomy while holding policymakers and the healthcare field accountable to rectify inequitable outcomes fueled by these unjust systems. Now, if you'd like to learn more, you can visit websites such as the National Association of Community Health Centers or KFF.org, formerly Kaiser Family Founding Foundation. Now let's revisit a little bit about what we've discussed in the past. We've touched on a lot of these concepts as they permeate the current administration's talking points, executive orders, elections, and even the Olympics. A few episodes worth mentioning include When You Know Better, Do Better, addressing ableism in healthcare. I discussed how the concept of ableism, or discrimination against persons with disabilities, negatively impacts how healthcare professionals interact with and diagnose patients with disabilities, and how this may result in equitable outcomes for these patients. We talked about how on June 24th, 2022, the Supreme Court of the United States abandoned its duty to protect citizens' fundamental rights by overturning Roe v. Wade, stripping childbearing persons' constitutional right to abortion, which is a medical procedure. This was the first time in history where we woke up with fewer rights than when we went to bed. The 2024 Olympics provided the opportunity to discuss the historic impact of women in the Games, with women bringing home 26 of 40, or 65%, of gold medals for the U.S., as well as the international shame that is femicide, the killing of women and girls due to their gender, usually by men, with the tragic murder of Olympian Rebecca Cheptegei, a Ugandan long-distance runner who was murdered by her estranged boyfriend. If you're new to the podcast, please catch up on these episodes and more, rate us 5 stars, and share with your networks and friends. Now that we're up to speed on some of the topics we've talked about in the past, where do we go from here? Of course, we're going to touch upon immigration, because if you've been even remotely paying attention, which I assume that you have been, as evidenced by your tuning in, the current administration has unleashed ICE, the United States Immigration and Customs Enforcement, on U.S. citizens and undocumented immigrants in language manners, because no one is illegal on stolen land whose wealth was built by the labor of stolen hands or enslaved Africans. We'll talk a little bit about why is there so much focus on Minneapolis, Minnesota. Take this into consideration. There are about 130,000 immigrants here who are in the U.S. illegally in Minnesota, according to a 2023 Pew Research Center data, the most recent year available, which represents maybe about 2% of the state's population and 1% of the undocumented population nationwide. Now, it's important to take into consideration that 78 metro areas have higher proportions of immigrants in the U.S. illegally than Minneapolis. Now, a recent 2025 estimates indicates that Texas hosts about 1.97 million, or 14%, and Florida about 1.22 million, or 9%, totaling roughly 23% of the nation's unauthorized population. So that's Texas and Florida combined 23%, and Minneapolis combined maybe about 1%. Stay tuned for our next episode where we'll discuss the hyperscrutiny on Minneapolis. Some of you may be asking, well, why is this my fight? For some, this may simply mean your privilege is showing. For Indigenous and Black people for whom these times are by no means unprecedented, your inquiry may be more warranted. We'll unpack that next time as well. Let's recap some of the major points for this reintroduction. Inequitable healthcare outcomes are avoidable and preventable. The social drivers of health are impacted by inequitable policies and practices that further the divide in healthcare outcomes amongst individuals based on their identities and socioeconomic circumstances. Policies and pop culture's role in perpetuating ideas about who is worthy of health, wealth, and humanity all play a role in how we receive health care and the right to pursue social justice. But as we tread deeper and deeper into the FAFO portion of this administration, I wanted to share some important resources for staying informed and empowered. The 2026 midterm elections are upon us. All 435 seats in the U.S. House of Representatives and 1/3 of the seats in the U.S. Senate are up for vote. The partisan composition of Congress can have a major influence on what the president can do during their term in office. States will often add other races to the ballot. Your ballot might contain races for governor, state representatives, judicial, and other offices as well, so be sure to stay informed. Different states have different primary and general election dates, so make sure you are registered to vote and find out when your state's primary and general election dates are. You can simply Google it or go to sites such as usvotefoundation.org. So please join us next time as we do a deep dive into immigration policies, rights, ICE, and how you can get active. I'm Dr. Katrina Gipson, board-certified assistant professor of emergency medicine, and this is Culture Shock Therapy, your health equity prescription.